This is Dr. Christy Webb, psychologist in Chapel Hill, North Carolina. Mindfulness or mindfulness meditation is something that you may have heard about. It's been accepted as a treatment for depression and anxiety for about a decade. But what does breathing have to do with treating depression or anxiety or substance abuse? And why on earth would a therapist want to use it with her patients? Very simply, mindfulness is the practice of paying attention. When someone practices mindfulness, he or she is deliberately, intentionally choosing to bring the focus of his or her attention to a prompt. A prompt can be a word, a thought, an object, even the breath. The idea is to pay attention to, let's say, the breath, moving in and out, and whenever your mind wanders, to notice that it has wandered and to bring your attention back to the breath. Now, I could basically end this video right here because that's really all there is to it. It's simple, except that it's not easy. So first, I'd like to talk about why it's worth doing, and then I'd like to talk about what it has to do with treating mental illness. So why would anyone want to pay attention to his or her breath, or a candle, or the sound of a bell? If you have children or grandchildren, or if you've ever worked with kids, then you know how important it is to pay attention to them, to tune into them, and they'll let you know if you're not giving them enough attention. Our thoughts and feelings tend to let us get away with ignoring them for much longer than children do. If we don't tune in, it's really no big deal, for a while. Intentionally focusing on a prompt, for example, our breath, is a way to train our minds to notice what's there. We might notice that our nose itches, or that we have an urge to laugh, or to cough, or that we're feeling irritated, or we're having thoughts about our to-do list. The discipline of returning one's mind over and over again to the prompt, it trains our mind to settle down, to observe without acting, and to reduce our judgments. So being mindful teaches us, basically, to tune in to whatever it is that we're experiencing. But why would anyone want to pay attention to unpleasant thoughts and feelings? Well, the answer to this is the reason why mindfulness is so helpful in mental health treatment for depression, anxiety, and addictions. When we have unpleasant thoughts or feelings, it seems like a really good idea to ignore them, to push them away, to avoid spending any time on them. Unfortunately, that is exactly what will get us into trouble. Whatever we resist persists. If we don't intentionally turn our attention toward the depressive thought, or toward the worried thought, or toward the urge to take a drink or a drug or eat the whole box of donuts, it's more likely that we will act on that thought or feeling or urge without even meaning to, without being aware that we've acted. It's as if we shove the thought or the feeling out the front door and it comes back in through the back door and bites us on the butt. Using mindfulness, we tune into whatever arises, including uncomfortable or afflictive thoughts, feelings, body sensations, or images, and we let them wash in and wash out like waves at the beach. Other metaphors that people use are clouds drifting by in the sky, balloons, or a conveyor belt. We deliberately let each thought or feeling or urge pass through our minds or bodies without trying to hang on to it and becoming attached. Being mindful is also kind of like window shopping. So imagine that you're walking in your local mall or down a street of shops in your town, and you're looking in the windows and you're noticing things. Oh, I wanted to read that book. Oh, that is a really ugly pair of shoes. Huh, wow, I like that t-shirt. That's really cool. I like that. But you keep right on walking, right? The thing that you don't do is walk into each and every store, buy 10 of the t-shirts, one in every single color, put them all on and wear them all out of the store at once. When we get attached to a thought or a feeling or a body sensation or an image, that's what we're doing. We're wearing it out of the store. Now I want to add one more word here, and that's non-judgmental. As we watch the thoughts, images, feelings, and body sensations arise and fall, ebb and flow, come into our minds and go out again, it's important that we remain non-judgmental. These things are neither good nor bad. They just are. The moment that we become judgmental, oh, what's the matter with me? No, I don't want to think about that. We've become attached. We're wearing the 10 t-shirts. If you've ever suffered with anxiety or depression or with any addiction, then you know what it means to be wearing the depressive or anxious thoughts and feelings around, to be wearing your urges around. The practice of mindfulness is an approach that trains our minds to let those thoughts and feelings come and go. Mindfulness-based therapy has been found to be as effective as antidepressant medication. Research shows that mindfulness changes our brains. Some parts shrink and other parts grow. People report that with as little as 15 minutes a day of mindfulness meditation, they feel calmer, less reactive, and their symptoms are less bothersome. Now, the number of minutes isn't as important as trying it out. There are lots of books and articles and how-to videos out there, so you can conduct your own research project on mindfulness meditation. I tell my patients that it's impossible to fail at mindfulness. You may not stay focused on the prompt, but you'll be focused on something, and the act of intentionally, deliberately tuning in, that's mindfulness. Thanks so much for watching.